Okay, good afternoon. We're going to go ahead and get started. The Lunch and Learn today is going to be about women's health. It'll be the first 30 minutes, men's health, the second 30 minutes. But listen, because husbands, brothers, dads, wives, sisters, mothers, all can, learn from what you have going on. So we'd like to introduce Dr. Emily Klein. She's with the Women's Care Group at Johnson Memorial. So I'm going to let her kind of tell a little bit about herself, and then she'll start the presentation. Just want to make sure everybody has signed in. So if you haven't, come over here and sign in real quick. Thank you.
Hi, happy Lunch and Learn. I'm Emily Klein. I'm a gynecologist at Johnson Memorial Health, and I've been there for 25 years, except for I did run away for a year and a half when I came back. So, can you hear me? Can you guys hear me? Okay, I need this. She's making me use this. Okay, can you hear me now? Okay. So, I'm a gynecologist, and so we're going to talk about women's health today. And when we talk about women's health or health at all, we're talking about that we want you to live a really long time and be happy and healthy doing it, right? So how do we accomplish that goal? So basically, we want you to live long and prosper. So we're going to start with live long, and we're going to start by talking about what the leading causes of death are in women. And so the number one is heart disease, and it's responsible for more deaths in women than anything else, and it's responsible for more deaths in women than all cancers combined. So when we want you to live long, we're basically talking about cardiovascular health as primarily, and then cancer risk prevention secondarily. Fighting with this mouse here. So when we talk about heart health or cardiovascular disease, there's sort of three categories. So there's the heart and the blood vessels that feed the heart. There's the blood vessels that feed the rest of your body, and then there's the blood vessels that feed your brain. So cardiovascular disease in men is more likely to cause a heart attack, and cardiovascular disease in women is more likely to cause a stroke. So we'll talk about stroke first. And the symptoms of stroke, it's kind of like what you see on TV. So if you have the saggy face on one side, or a saggy arm on one side, or trouble speaking, or troubles with balance, or things like that, those could all be signs of stroke. Now the key point here is women are great minimizers of symptoms. We explain everything away. We always have one more thing we got to do before we go get checked out, and then a kid comes up and has one more thing that they need us to do before we get checked out, and then mom called, and then pretty soon we're in dire straits, and we're waiting till we're in dire straits, right? So we don't want to do that. Key thing for stroke is if you have these symptoms, and you can remember this little acronym here, FAST, you need to act on it fast. So if you have a droopy face, or someone you love has a droopy face, or if there's some motor weakness on one side, or they're having trouble talking, they're only a really good talker, but today they're just not making sense, then time is of an essence. So call 911, get to the ER, get them to the ER, because treatment can prevent death, but also prevent some of those long-term things that can stay with you. You don't want to end up the person who can no longer walk around by themselves, or can no longer feed themselves or talk. So remember, fast and act fast. So symptoms of a heart attack, that's also sometimes like what you see on TV, that crushing elephant sitting on my chest, and sweating and can't breathe, but it's not always like TV. And in women, some symptoms can be different. Now, like men, chest pain is going to be the most common symptom, but women sometimes will maybe only complain of some belly discomfort, nausea, or maybe they're just tired all the time, or maybe they get lightheaded and get sweaty. All of those can be heart disease. And once again, women minimize these and explain them away. Oh, I don't sleep well, or I got too stressed out by working home. but get these things checked out because heart disease is the #1 killer of women, and it doesn't always look like that heart attack that you see on TV. So what are risk factors for cardiovascular disease? And you guys could probably list these without seeing this slide. We know that as people get older, their risk for cardiovascular disease goes up. We know that high blood pressure, hypertension increases your risk for cardiovascular disease. So does a bad cholesterol level, so does diabetes, and certainly lifestyle factors like if you're not getting enough exercise, if you aren't maintaining a healthy weight, if you're not eating a diet that's real healthy, those can all contribute. And some of these things we can change, and some we can't. You know, we can't change our genetics, but we can certainly change things that are within our control, right? So what do? What's that mean? So before we get into that, I want to talk about some risk factors that are unique to women. So if when you were pregnant, you had blood pressure issues or preeclampsia, that increases your risk for heart disease. If you had gestational diabetes during your pregnancy, that increases your risk for heart disease. So does polycystic ovary syndrome. A lot of women have that in their history. And then one of the unique things is women who are over 35 and smoke, if they're on birth control pills, huge increase in heart attack and stroke. So those are things that we look for and need to address. Okay, this mouse hates me. I need a little mouse. Okay, so when we talk about heart healthy lifestyle, we're talking about eating a healthy diet, and we'll talk more about that. We're talking about alcohol in moderation. I'm never going to begrudge anybody their glass of red wine with dinner, but keep it to one drink a day to keep it safe. Try and get to and maintain a healthy weight. It's not always easy, but there are little things you can do to tweak it. Not smoking is certainly beneficial for heart health, and then getting enough exercise. So we talk about getting at least 150 minutes of exercise a week, and that can sound daunting, but the 10-minute walk at lunch or the 10-minute walk in the evening, after dinner, it all adds up. It's all cumulative, it all counts. You don't have to go and work out for an hour, just you want your body to move. You're right, this thing does really. Okay, so when we talk about a healthy diet, I love this. This is so simple. Eat food, not too much food, and mostly plants, okay? So what's that translate to? We wanna eat more of vegetables and fruits. We wanna eat more beans, low-fat dairy products, fish and poultry, and healthy unsaturated fats, and a lot of fiber. And we wanna stay away from all the stuff that tastes good, right? Well, that's not completely true because a lot of the healthy things do taste good if you make it right. Red meat, I like a good steak, but you don't need to have red meat every day. Sugary foods, processed foods, high in sodium, and fast foods. So this is another good little take on it. Eat more food that comes from trees and plants and less food that's manufactured in plants. And what I tell my patients is if your grandmother, or for some of you younger people, if your great-grandmother wouldn't recognize what it is on your plate, don't eat it. It's probably way too processed and probably not healthy. So, okay. So now we're going to talk about the other killers of women, and we're going to talk about cancers. Okay, so the most common cancer in women is breast cancer. So that's 1 in 8 women has breast cancer. So how many women are in the room today? 1, 2, 3, 4, 5, 6, 7, 8, 9. Somebody. Okay, that's scary, right? That's really scary. So we got to pay attention to that. Lung cancer, 1 in 17. Colorectal cancer, 1 in 24, and that's actually increasing in younger people. Uterine cancer, 1 in 36, and thyroid cancer, 1 in 57. So, but when we talk about the likelihood of dying from one of these things, breast cancer, you have it, it's 1 in 38. Heart disease, you have heart disease, 1 in 3. 1 in 3. So we still want to pay attention to that. Okay, we don't want to forget cervical cancer, skin cancer, or ovarian cancer, and those are also things that can be monitored and screened for routinely. There we go. Okay, so what can you do to decrease your risk? Well, I sound like I'm repeating myself here because I am. right? We want to stay away from tobacco. We want to have a healthy diet. We want to get enough exercise. We want to keep the alcohol to a moderate level. We want to protect our skin, so sunscreen. And we want to know what our risks are. So it's important to know your own medical history, important to know your family history, because that can help your physician help you decrease your risk. So that brings us to getting checkups, which can include cancer screening and genetic testing. So we all know about pap smears for detection of cervical cancer, and how often you get those and what the follow-up is for that really changes depending on age, and that can be discussed with your doctor. Same thing with mammograms. We recommend a mammogram starting at age 40 and yearly thereafter, and that's really important, along with a clinical breast exam by your doctor, and then a breast cancer assessment, which kind of takes into account family history and some of your lifestyle things. Colorectal cancer screening. We used to recommend a colonoscopy or a Cologuard test starting at age 50, but the incidence of colon cancer is going up in younger people, so now we're actually recommending that starts at 45. And then there is some genetic testing for cancers for lots of different things. And one you might have heard about is BRCA testing, and it's a blood test or saliva test that looks for a gene that could put you at increased risk for breast or ovarian cancer. So we talked about, live long, and now let's talk about prosper. Some of the things that can happen, they might not kill you, but they might make you miserable anyway, right? So let's talk about prosper and not being miserable. So we're at the corner of live long and prosper. So we want to do things that get us living long, but we don't want to overdo it and make our happiness suffer, right? So it all can be very overwhelming, and so where do you start? So there's a list of what I call the other big bothers, the ones that aren't on the list of things that'll kill you. Anxiety and depression. I think there's not a lot of attention necessarily paid to mental health, right? These things are important. They really can affect our quality of life, and they deserve attention. Alcohol, tobacco, and substance use and abuse. We want to curtail those because those can really impact our life. Domestic violence, okay, that's something we don't talk about. It's an ugly word, it's out there, and women die from domestic violence every year, or if they don't die, their life is so affected and limited that they're very unhappy, very unhealthy. Incontinence, okay, who talks about incontinence? I do. Wet pants really decreases quality of life. It's not a normal thing, it doesn't have to be something you suffer with, and it can be taken care of. Infections, which includes sexually transmitted infections, but also includes other infections. If these things can be screened for, managed, treated. Diabetes. A lot of patients don't know that they have diabetes until way into the game because they aren't screened for it and it's not monitored for it. And then hypothyroidism. So thyroid is a little gland in your neck, and when it doesn't function well, it can cause problems with your heart, it can cause problems with your weight, it can make you feel tired all the time and just feel like a slug and feel cruddy, and it can feed into anxiety and depression. So another thing that is good to get screened for. So we advise regular checkups. So why should you go to the doctor if you don't feel good? I mean, most of us, I feel fine, I don't need to go get checked out. I'm probably guilty of that too. My doctor's sitting over there and I haven't seen him for 2 years. So the best reason is to stay in contact with somebody, A, so they can keep you well, but B, so that if you become unwell, you have somebody to call and you don't have to fall back on urgent care, the emergency department, somebody who doesn't know you and your story, who might order more tests than you need or might not be able to put their finger on what's going on because they don't know you. So it's best to have a relationship with a provider so that they can kind of help you ride herd on all of these things that you need to keep on top of. It can be daunting, right? So they can screen for medical issues that you might have. They can talk to you and look at things and see what you might be at risk for in the future and help you kind of decrease those risks. You get an instant cheerleader. You get somebody who's going to encourage you, to have healthy lifestyle changes and give you support, give you tips and tricks, things to build you up to be successful in that. You can get your vaccinations updated, keep you from catching some of these things that are floating around out in the universe that we don't want. And then, like I said before, then now you've got a friend where you can call, you can get in, and you can get taken care of if you do have a medical problem. So what do regular checkups entail? And it's a long list, so how can anybody keep track of that? Well, we do. We keep track of that for you. So you're gonna get a regular checkup, a physical, you're gonna get your blood pressure checked. Depending on your age, you might get your cholesterol checked and your thyroid level checked. You might get a bone density test to make sure you don't have osteoporosis, which is thinning and brittle bones. You might get a mammogram ordered if you're in the right age group, a pap test, depending on how often you need those, testing for sexually transmitted infections, and maybe even a colonoscopy. We all look forward to that. We can't forget our skin, right? So if you have moles that have changed or new moles, those need to be evaluated. Okay, skin cancer's out there, wear sunscreen. And I think that a lot of times eye health and ear health are overlooked. You know, they're for some reason not really covered with our medical insurance. I think they should be. But you know, how's your vision? How's your hearing? Those things impact our quality of life and are really important to stay on top of. And so is the dentist. Okay, oral health is so important, and a lot of people probably don't realize or don't know that poor oral health can actually lead to heart disease. Everything's connected. So if you take care of your mouth, you might also be taking care of your heart. We talked about mental health, screening for anxiety and depression. Those things really need to be held into the spotlight because so many people suffer from those. And again, vaccinations so that we don't catch some of these bugs that are running around out in the universe. So what can you do? Okay, it's all daunting. It's like, where do you start? What can you do? So ask questions, right? When you go to your doctor, ask questions, ask for information. Go ahead and get on the internet, as long as you get on a reputable site. Go to the Mayo Clinic, or Cleveland Clinic, or one of those, and get reputable information, and then you can ask follow-up questions at your appointment. But be your own health advocate, okay? We're not here to drive your health care for you. We're here to partner with you in your health care, and what we're gonna do is we're gonna give you information, we're gonna give you options, but then you get the choice of what you do. But we're here to help you achieve that. Get screened, okay? If you don't know you have something, then you can't treat it early and keep it from taking over your life or taking your life, right? Again, with the healthy diet, exercise, and healthy weight, and again with the maybe only one glass of wine a day. So I want to touch a little bit on a few things that people don't really realize are part of health. And the first one is getting enough sleep, all right? Who gets enough sleep? Anybody in here get enough sleep? No. Okay, so we say get at least 7 hours, right? 7 to 8 hours. Who does that? Who does that, right? If you're not getting that much sleep, you're shortening your life, all right? You can't get 4 or 5 hours a day and then try and make it up on the weekend. Because they also say getting more than 9 hours isn't good for you either. So look at your schedule. See where your time is. Where are your marginal minutes? Where can you get stuff done? Where can you plug that back in and get enough sleep? All right. So just kind of keep that in mind. Drink enough water. We can't walk around being a bag of dust, right? All our organs need water to function. And we don't know what the magic number is. We say 6 to 8 glasses a day. That might not be that much for you, but you're drinking enough if your pee is clear, right? If you're only peeing once or twice a day, you're not drinking enough water. So drink more. And then the third thing, nature is our friend, okay? We're so in our cubicles and concrete buildings and on the computer, and it's amazing what just a few minutes a day or a week getting back into nature can do for your overall health. It decreases anxiety, you get to breathe some fresh air and get some sunshine, or sunscreen. And most of the time, if you're gonna be out in nature, you're gonna be with your friends or your family, so you're gonna be having some emotional well-being too. So just, again, with the after dinner walk or the lunchtime walk or go to a park, go fishing, go do some of those things outdoors, and it's really going to help your overall health. So we've covered a lot, and again, where do you start? You start with visiting your doctor and letting them help you with that list, and you don't want to try and change everything at once. It's never a success story when you try and change everything, but if you change one or two things and then you're successful at that, and then later you change one or two more things, you're going to build on that success. But it's like anything. It's like, how do you eat an elephant, right? One bite at a time, okay? But you can start somewhere and you can be successful. So we're here to help. Thanks for letting me chat at you today. I'm Dr. Klein, and I'm with Johnson Memorial Women's Health Specialist, and I'm the medical director of the Care for Her program. Currently, we're providing treatment for urinary incontinence and pelvic organ prolapse. Don't need a referral from your doctor for these things, and we can also help you to get directed to any other health services you need for women's health. So thanks for the time. Does anybody have any questions? I guess I should say. Anyone? Yeah.
I've heard two different things on this. That hysterectomy is recommended to in ovarian cancer. Is that true?
So, first of all, let's talk about what complete hysterectomy means. So, if you're talking about a hysterectomy where the ovaries remain, then yes, if the ovaries are still present, yes, there's a chance of ovarian cancer. If you're talking about a hysterectomy where the ovaries have been removed, then the answer is yes, you can still get ovarian cancer because there can be potentially a little bit of ovarian tissue left behind that might only be microscopic and might not have been seen. So that is true. So women still need to have a checkup even if they've had a history.
So what do they check?
So we're just checking about any symptoms, any pain, any things like that, but also to see if we feel any masses or see anything unusual on the exam. So, yeah. Anyone else? Nope? Okay, thanks.
All right, we're going to just switch things over here, and then Dr. Michael Young with Johnson County Internal Medicine, where Johnson Memorial Health will be talking about men's health.
You want to hold this or do you want to do that? Because I couldn't get that. And so, and there's a little, she's going to, there's a,
Hang on. Here, use it. Let me get it. Okay, you're going to be from beginning.
you know what's funny? We used the same.
That's funny. Yeah. I think you can't see it very well.
Yeah, I know, but we used the same format or slides with the purple.
That is funny. Hi everyone. Thanks for letting me come and talk to you. I didn't know, gosh, the ages of everyone. So if this doesn't apply to you, it might to your parents or grandparents or something, but these are things you can do even if you guys are out there in your 30s, 20s, or whatever. So, and if you can't hear me, let me know, or if you can stop and ask a question, I'm fine with that too. I hope I can do this stuff next. So let's see. Okay, so why go to the doctor? Why do men go to the doctor? Well, there's one reason, and it's a woman. Usually, it's the wife, girlfriend, mom, daughter, someone, almost always. But that's okay. And it's usually to either there's a symptom or they want to know how can I get healthier, how can I live longer, or they come in and say, I like this one. I just had a new granddaughter and I want to see her grow up. So what do we look at to see how do we do that? And what I'm going to do is just go over some of the most important things that we want to look at to try to identify, prevent, and briefly how we can do it. And then a few questions at the end, maybe what men tend to ask when they come in. So what do we die from? Well, number one, cardiovascular by far. Number one, heart attacks mainly. And then cancer, and then it drops down quite a bit to accidents and other things. And this doesn't include COVID. So I'm going to talk a little bit about heart things. And this applies to women too. It really does. So you look at what are the big risk factors, and I'll just say a little bit about each one because you guys will go, yeah, I know this, but so hypertension, the only way you know you have hypertension generally is to get it checked. And so everyone starting in their 20s should have it checked periodically, depending on how high it is. Sometimes though you come in the office and it's way higher than it is. Anyone who gets a CDL knows that. I don't know if you guys have to do that or not, but you have to have a blood pressure over 140 over 90, you can't drive a truck. So sometimes if someone's borderline or high, we have them get it checked at home, get a monitor for home. Generally go up under 140 over 90, although ideally it's 130 over 80. Over 50% of males have hypertension. So it's really common. And a lot of it's genetic. Like you can change it to a point, but sometimes you just need medicine. So then cholesterol, similarly, is very genetic. You have to get it checked. So usually in the 20s, we'll have people get it checked, definitely by 35. But the goal cholesterol level depends on how much risk you got. So the people who have high risk, say someone who's had vascular, like strokes, heart attacks, stents, our goal is way down here. So they almost always need medicine. For people who are healthy, like a lot of you guys are real healthy, we may let it go much higher and not push a statin on someone. And there's a formula you can use actually that predicts your 10-year average risk of having a vascular event. And sometimes we use that to decide on cholesterol event. And then smoking, I mean, enough said. The good part is it's getting less common, but it's still very common. We have ways to try to help people with that too, although it's hard, I have to admit, but we have ways. And then just three more. Diabetes, again, the only way you know you have diabetes is to get your sugar checked, usually at least by age 35. And the big point with diabetes is it's incredibly common and getting more common. And if you look, to have diabetes, you just have to have a flat fasting sugar of over 125, so 125 up, and or an A1C, which is a blood test that gives you your average 3-month sugar average of 6.5. And it looks almost 11% of Americans have diabetes. But then there's a category just below that called prediabetes, which over a third of the US has. And that is just a little lower, to a fasting sugar of 100 or an A1C of 5.7. So the point is it's really common, and the only way you know you have it is to get checked. So, and depending on how high it is, depends on how often we check it. If it's really good, we might only do it every few years, but if it's borderline or high, much more frequently. Then overweight or obesity, that's a major problem and getting worse. And it's all based on a BMI or body mass index, which a lot of people don't think is too fair, because it's all based on your height versus your weight. And it takes a BMI of 30 to be obese. obese, and that's 40% of the population. And overweight, 72% of Americans are overweight. And it's a whole talk in itself, and this is a really common reason people come in to see me. We have ways to deal with it. It's frustrating, because there's a big genetic component to this too. But anything we can do to help will benefit you. And then the last one here, you can't do anything about with family history. And family history is considered a male family member who's had a heart problem or a vascular problem before 55, age 55, a female before 65. And generally what we do with people with big family histories, we just get more aggressive with the risk factors. So if you're borderline in your blood pressure, we might treat it with medicines, cholesterol the same way. We just get more aggressive and it might screen for it earlier too. So this is all the stuff we know. So we gotta eat better, exercise more, lose weight, stop smoking, and know your cholesterol, sugar, blood pressure, and maybe treat it. So easy, not easy, but it's worth it. Any benefit we can get. I'm just going to touch on diet real quickly because nobody agrees on this, and everyone has their own diet. There are like keto, modified keto, intermittent fasting, all these diets. Most of those, though, are geared for weight loss, and they do work in a lot of people. The hard part is you can't keep it up. I mean, most people they'll lose weight, but then over time, it just creeps up because it's too hard to do long term. But some people are successful, but what most people agree on is that we need to eat more vegetables, fruits, nuts, beans, fish, olive oil, less sugars, white bread, white rice, red meat, which isn't typically how we eat in this country. That describes what's called the Mediterranean diet. And most studies show a big benefit with that, but it's hard to do. But the 2 points, one is you gotta find something you can live with. And often we get a nutritionist or someone to help out, but you gotta do something that doesn't feel like you're dieting, or you'll fail every time, or 95% of the time. The other is, there was just a big study just last month, interestingly, that they looked at people who started eating better, like started eating more of these fruits, vegetables, nuts, seeds, the Mediterranean diet. And they looked at it when they started at age 20, and they lived an average of 12 to 13 years longer. But then the really interesting thing is they looked at people when they were 60 or 70 who started doing it. So they didn't eat so great most of their life, and all of a sudden now, can someone do it? It could be done, it wouldn't be easy, but they started eating better, and they lived on an average of 5 to 8 years longer. So it shows it's never too late to do this. Oh yeah, I thought this was funny. This is so true right now. I don't know if you guys can read that. It says, I finally found a diet plan that really works. It's called The Price of Food. So I thought that was unfortunately true. That might work. Okay, so just a couple things on exercise. And I don't know if Emily talked about this or not, but I'll just do it real quickly. So how much are we supposed to exercise? 30 minutes, 5 times a week, 150 minutes a week. That's ideal. But I didn't put it up here, but really, any exercise is good. And I should have put that big bold letters. Any exercise is good. But a couple things about this. So what's moderate exercise? It's not just walking, just slowly, just barely walking down the street. It's a brisk walk. You break a sweat after 5 to 10 minutes. You can still talk, but you can feel it. But a more scientific way is based on heart rate. And I don't know if you guys, this time when we have Fitbits and Apple Watches and so forth, it's really easy to monitor your heart rate. So there's a formula it's called the maximum predicted heart rate. It's 220 minus your age, and then you multiply it by some percent. So moderate exercise is considered 50 to 70% of your age predicted maximum. So say you're 50 years old, 220 minus 50, which is 170, and then you multiply by 0.7, 70%, and that's 119. So 110 to 120 would be moderate exercise. Now, vigorous exercise is considered 70 to 85% of your age predicted maximum. So that would be for a 50-year-old about in the 140s. And if you do vigorous exercise, they say you can do half as much, so 15 minutes, 5 days a week. But again, any exercise is good. And you can't just jump in there and start doing that typically, or you'll be miserable and quit. And then they recommend strength training at least a couple times a week, which is like weightlifting or those rubber bands, like resistance training. So any exercise would be good. And I know these things are hard, but these are the ideal things to decrease your risk of vascular strokes, heart attacks. So how about alcohol? This is kind of a big one. Because we've always said, well, a glass of wine or beer or whatever a day decreases your risk of a heart attack or a stroke. Until this year, and there was a big study that said they're not so sure it gives you any benefit. But a lot of studies have shown some benefit, so it's kind of up in the air. But the key to this is moderation. So if someone does drink, that's okay. I have nothing against that at all. Just for a male, up to 2 drinks a day. For a female, 1 drink a day. Anything above that isn't good anymore. And also alcohol increases your risk of AFib, which is a fast heart rhythm problem. So it's not all positive. But then again, if you do drink, just moderation. Aspirin, this is kind of one, and you guys are younger, so this may be boring, but we've always told people to take an aspirin, the day as you get older. But the latest is, if you have a known problem, like a CAT stent, heart attack, stroke, you're going to be on some kind of aspirin-like med. But say you have no problems, no vascular problems, and you're over 60, so you take an aspirin to prevent a heart attack or a stroke, and the latest study says, no, don't do that, because your risk of bleeding is higher than your benefit. Now, if you're between 40 and 59, it depends. Like, say you have more risk, you're diabetic, you have bad cholesterol, it might make sense, but that's something to talk about with your doctor. But if you're perfectly healthy, between 40 and 59, generally we say, no, don't take an aspirin. And then supplements, this will get people mad at me, but I have nothing against supplements at all. But there really haven't been any good studies that show benefit to supplements to decrease your risk of a heart attack or stroke. And I say that good because it's bold there. They don't do real good studies with supplements because they're too expensive, they take too long, nobody does it. So I'm not against supplements at all, it's just moderation is a big thing. And some have shown benefit for other things, but not generally for vascular disease. So that would make people mad. Oh, I just thought this was funny. Can you guys read that? It's funny. Yeah, this lady's doing Pilates after drinking all night, which is 23. And this lady's like at the bottom of the steps of lifeless after she changed the laundry at 10:15 the night before. So that's why we want to get in shape, so we can drink till 4 a.m. Not really. So here's the big point. So say someone comes in, this is real common too. Someone comes in and says, my brother just had a heart attack, and I want to make sure I'm okay, because their wife just made them come in, of course. So how do you know you have a blockage or have a high risk of a heart attack? The only true way to know is to have a catheterization by a cardiologist. But the only way they'll do that is if you've had a heart attack, if you have an abnormal stress test, if there's a really good reason to do a cath. They just don't do it routinely. So the next test would be a stress test, and those are usually treadmills or an injection of a medicine that simulates exercise, coupled with some kind of imaging test, like a nuclear test, PET CT, or an echo. And you can't see it very well, but there's these real bright colors on that. That's a nuclear stress test, which is probably the most common. You can see exactly where the blood goes at rest and at exercise, and from that they can tell if there are any problems where parts of the heart aren't getting enough blood. And then based on that, you might need a cath, or they might say your heart's great, so it kind of helps. Say you have no symptoms, and you're not real high risk, there are these things called heart scans. You see them on TV or magazines. Every hospital does them pretty much for $49. And what they are is they're a CAT scan of your heart with no IV or contrast, and it looks for calcium, and calcium tends to be in plaque, which tends to be what causes blockages. And it gives you a score, and it gives you a score for each of the 3 main arteries and a total score for the whole heart, and then it compares you to people of your same age. And so sometimes that's useful to decide if you're kind of low risk, medium risk, or higher risk for a vascular event. It's not a CAP code, it's not that good, so it can't tell you you've got a 95% blockage in one of your arteries. So it's just another tool to look at, but where sometimes it's really useful is, say someone's cholesterol is moderately high, and we're considering a medicine, and they do a heart scan and it's not so great, we may be more apt to start the cholesterol med to be a little more aggressive with the risk factors. And then this last one's pretty obvious, but it's really probably one of the most important ones, is we ignore things. We're in denial, we get this chest tightness, we say, oh, that's just heartburn. You get this pain in your middle of your upper back when you're doing stuff, and that's just muscle. Well, you're much better off going to the ER, getting checked out with nothing versus ignoring it. And our tendency is to ignore things. So listen to your wife or girlfriend when they make you go to the ER. But that's something that is real common. We just tend to ignore things. So, and women, it's hard because women are just a little different. Sometimes their symptoms are not the same. They don't have the pressure at their chest. Sometimes they're short of breath for no good reason, or something else. They just don't feel right, just vague. Okay, so now I'm going to switch gears. That's hard. How about lung or cancer? How do you screen for it? How do you not so much prevent it? I'm not going to talk about that, but how do you screen for it? Well, the 3 most common cancers that cause death: number 1 is lung cancer, number 2 in men is prostate, in women it's breast, and then colon is number 3. For lung cancer, if someone is a smoker or they've been a smoker and quit within the last 15 years, then you can get something called a lung scan, and it's sort of like that heart scan. And hospitals do it usually for $99. It's sometimes $79. And what it is, it's a low radiation CAT scan of your lungs that looks for nodules. And it's the best screening test by far for lung cancer. But you have to meet those criteria or they won't do them. Now, if you have symptoms, that's different. We can order a regular CT scan, but you have to have symptoms. So, and then prostate cancer, that picture's funny. I mean, it brings terror right there. But the funny thing, we don't even do that anymore for prostate cancer screening. We do the PSA, which is a blood test, but you don't start till 50. I don't even know how many guys are 50, but sometimes 40 if there's a family history. And then colon cancer, this is a big one because we're seeing colon cancers at a younger age for some reason, like in the 40s, and it's probably our environment. But you start screening at 45 now, and I wouldn't be surprised if it doesn't change to 40 here at some point in the near future. But there are 2 tests we generally do. One is the colonoscopy, which is probably the best test, but it's a little more involved. You have to get all cleaned out the night before and sedated and so forth. But the advantage is if they see anything, they can snip them out, polyps, etc. But another one that really is a good test is the Cologuard test. It's on TV, little box they can send your stool in. And it's a it checks for DNA markers in the stool that tend to go along with high-risk polyps and cancers. Now, when it's negative, it's a really good test because it's just as good as a negative colonoscopy, and we do it again in 3 years. Now, if it's positive, we send someone for a colonoscopy, and there definitely are false positives, but any screening test is set up that way. But I'd say 8 or 9 out of 10 people, it's been negative when we've done those. And I had one person just recently, they had a positive one, ended up getting a colonoscopy, and they had stage 2 colon cancer, and it'll save their life, I'm sure. So nobody wants to do this one, but it's really important. Okay, let me see. Okay, so here are some questions that men tend to ask, but women too. So So Emily talked a little bit about sleep, the 7 hours, but I'm just going to go at sleep apnea just a little bit because it's so common. You know, usually sleep apnea is someone snores like crazy. Often they're a little overweight or have a big neck. But the symptoms, sometimes the symptoms they're so common you're just exhausted. But usually, if you have at least moderate sleep apnea, you can just fall asleep with a drop of a hat. You know, after lunch, you're sitting there reading, you're watching TV, you're just howling. People often wake up in the morning and still feel like they need 2 more hours of sleep, even if they slept 7 hours. Sometimes people have to get up and go to the bathroom during the night, urinate, and you think it's your prostate, but it's sleep apnea. A lot of times, amazingly. So, in sleep apnea, if someone has it, it causes all sorts of problems. Car wrecks, which makes sense because you fall asleep, high blood pressure, heart attacks, strokes, AFib, and you do a sleep study to diagnose it. The good part is we can do them at home now. Do this little kit. It's not quite, it doesn't test for quite as many things as the in-hospital one, but it's so much easier and people are more willing to do it. So, and then the treatments, I won't go into those, except usually CPAP's a big one, the mask. Unless there's a bad commercial on TV, on the Inspire one, I just put it up there. That's what it is. It's a little device that the ENTs put in at the base of your tongue, and you hit this button and it moves your tongue forward. It's like a little stimulator, so it creates more space behind your tongue so you don't block off. But sleep apnea is a huge problem that's underdiagnosed. Oh, this is for men, but women to listen to here. Low T. So we're bombarded, you know, with these bad commercials for testosterone on ESPN, satellite radio, whatever, just constantly. And if you look at the symptoms, you think, well, everyone's got them as you get older. You know, just tired, less energy, less muscle mass, sometimes kind of depressed. Those can all be low testosterone symptoms. The only way to absolutely know, though, because you can't tell by just looking at someone, the only way to know is to do blood tests. And you have to do morning testosterone blood tests, and most insurance companies make you do at least 2 of them before they'll pay for anything. So there are critics of this, and they think there's risk with testosterone. It can increase risk of blood clots, possibly, prostate issues, vascular disease after years of use. It's a little bit up in the air. But I will say, if someone truly has a low level and they have the symptoms, they usually feel dramatically better if you get supplemented. And the way we usually supplement is either it's gel that you rub on your chest and it evaporates after a few minutes and then you get dressed, or you give shots to yourself at home every week or 2. There are a lot of supplements out there, like GNC and those kind of things. And it's hard to know because, again, they don't do studies on these. They don't have to. And I've had patients who've taken them and their testosterone level did go up some, but we don't know the risk. Generally, and I've had some that didn't work at all, they're not cheap. So generally, I wouldn't recommend the supplements just because there's no good studies, but, and you just can't tell someone what to expect. But the prescription versions, they do work. But if you're not truly low, I wouldn't do it because there could be risk. Oh yeah. So it's got to be a men's talk. I got to talk about this. So what about like ED? I mean, this is a big. I'm going to make a couple points about this. One is it's incredibly common, and the other is it might be a marker for medical issues. So, I mean, it causes like stress in relationships, and people are embarrassed to ask. I wish they would ask, and more people are asking because we have ways to treat it. But just a point, 40% of men by age 40, roughly 50% by age 50, and 70% by age 70 have issues. And the reason is the problem that causes this is the same problem that causes heart blockages. So it's blockages in the arteries. And the arteries that lead to ED problems are about 1/8 the diameter as the heart arteries, so they block quicker. So this can be a marker for impending heart disease, sometimes about 5 to 10 years earlier. So it really can be an important medical issue too. And the way to prevent it, so a lot of you younger guys, the way you prevent this is exactly the way you would prevent heart disease. So you gotta eat better, exercise, treat the cholesterol, blood pressure, all those things. A couple other things would be testosterone, and treat it if needed. Sleep apnea, believe it or not, is associated with it pretty significantly, and alcohol, if someone drinks pretty regularly. And then just a really brief note on the treatment. The reason I'm going to say this is because these things used to cost, the medicines for this cost a fortune. They used to cost $40 a pill, and that wasn't very long ago. But now with Good RX, you can get it for about 15 to 20 bucks for 30 pills. And so that, I'm only saying that, don't be afraid to ask for these because they really do help. And they're much more affordable now. And then if they don't work, there are other things we can do too. But it's the big thing, it's very common, don't be afraid to ask, and it does cause problems. And it's frustrating and very common. So I kind of flew through a bunch of things, but that says, thanks to my doctor for keeping me healthy so I can save my sick days for when I'm not sick. That's the goal. So do you guys have any questions? So you do all that, you live together. Not easy, but you know, it's just anything you can do helps. So that's, we just work on it all the time. Thanks. Hopefully I'm the last speaker so you can go do some more fun.
And then know that if you don't have a primary care physician, like they stated, it's very important to have a primary care physician. Even if you feel that right now I don't need to go to the doctor, I'm all healthy. Like I said, get into someone, get them, get to know them. Just in case that something happens, you've got that person to go to. And then the screenings are very important. If you're interested in seeing either of these guys, you can let me know and I can get you set up with them. Or if you go to johnsonmemorial.org, there's a little thing there that's for physicians, and it has their contact information and things like that that you can give them a call and get set up as a patient if you need to. Okay? Thank you very much.
All right.
Thanks.